I'm always curious about who thought to connect those two, the horse and therapy.
So, I actually did my whole capstone thesis on equine therapy. Off the top of my head, I think the first time that they used animals in psychiatry was in Europe. They had a group home type setting or a psychiatric inpatient type setting, and they started just incorporating small animals, dogs, cats, and found that it improved the quality of life and the happiness of the individuals living there. And then it kind of grew. A lot of the animal-assisted therapies started out with dogs and cats because they were the most accessible, but really horses offer a little bit more than dogs and cats because of their, like I said, emotional sensitivity, and then also because of the things that we require from them. So it's pretty straightforward to teach a dog to sit, lay, stay, and they might respond to that cue from somebody who's in an excited state, a sad state, a fearful state, because they know the cue. But a horse, the requests that we make are actually much more complex than just a cue. So you might do the cue perfectly, but if you don't do it in the right mindset and in the right emotional space, they won't respond to it. So it really gives that detailed biofeedback mechanism. Also, just the aspect of riding a horse in the attachment theory brings you back to this body sensation, which can kind of simulate the rocking that some people didn't receive as a soothing, comforting experience growing up. So it gives an opportunity to recreate that.
Oh, so this is kind of a bit of a laboratory for people to be able to adjust their behavior to get a desired result.
Absolutely.
Okay.
So, and I've seen this work wonders. We're just kind of starting to utilize it in the practice that I work at, but I've been kind of on my own, having just some volunteer people bring their children that were maybe troubled. I'm working with a boy that has ADHD and peer issues at school, and then a little girl with autism. They're coming out and working with the horses. And
that's super.
It's been a miracle for especially the little girl that I'm working with. She's been doing it a little longer. But
so what type of population is this generally most beneficial for?
So the major issue in equine therapy is the lack of solid research, and that's not because it's not, qualified research. It's just that nobody's done it because it's such a new thing. But in the research that has been done, we've found benefit in almost every one of the groups that have been tested, specifically PTSD. So there's programs that work with veterans and also rape victims. There are ADHD studies that showed improvement. Anxiety, depression, and actually schizophrenia as well.
Now that is interesting, of course, to myself. So reading your capstone project, I catch the autism, the ADHD, the things like that. But tell me about the schizophrenia, the PTSD, how that helps.
Well, in schizophrenia, obviously a horse isn't curative, as that's a long-term psychiatric condition. But what they found is a lot of times these people are trapped in their minds, and even though another person might not be schizophrenic, hearing things.
That's a telling statement. Trapped in their mind.
Exactly. I mean, you and I might not be hearing things, but if we get too attentive on our thoughts and lose track of the present moment, it can become overwhelming.
And I can see where the horses fit in, because when people may be trapped in their mind and maybe have some thoughts that other people don't think is correct, they can say those to the horse, and the horse isn't going to tell them that they're wrong.
Yeah, and actually it even brings them out of their thoughts. So when we've been including horses in some of the groups that I've been running, somebody can interact with a horse 5, 10 minutes, 20 minutes, doing very simple maneuvers as far as equestrianism is concerned. But the whole time they're right there. They're paying attention to that horse and what they're trying to get them to do. They aren't thinking about the future, the past, their thoughts, if their thoughts are real, if their thoughts are false. It just gives them presence in the moment. And as far as I'm concerned, it's one of the most effective things at getting people to be present in the moment, because I have seen people that can, go do yoga, and the whole time they're in the pose, they're just thinking about things that they're going to do later that day or things they didn't do yesterday. When you're with a horse, they really demand your attention to get the appropriate responses that you want from them. So you can just be in the present moment for a long period of time, and they're again the Zen master that keeps calling you back to that present moment if you get distracted.
Let's walk this thing through. So you bring a child in. Are their parents with them?
That depends. I mean, if a child needs parents for reassurance, they can be present. If not, it's really between the child and the horse. The horse is the instructor and I'm the facilitator.
Okay.
So I'm present, making sure there's safety and there's guidance in the interaction. But the magic happens just between the horse and the patient.
So I'm assuming that first off, you introduce the child to the horse, the name. The child can get close to it, maybe touch it, maybe stroke it eventually. So where did you're going to have to really educate us as we're have a mind of uncertainty about this, whether they ride the horses, whether they pet the horses, whether they talk to the horses.
So there's actually a couple different schools of equine therapy, and here again, this is where research is going to lead us to great places in the future, because we're going to figure out what seems to work best for what diagnoses and all of these different details that aren't quite clear. But there's a schooling called EGALA. The EGALA model doesn't include riding. It is predominantly a person coming in, meeting horses. They actually don't even learn the horse's name in that model. They just want the person to have a total open experience without any biased judgment of the horse. They guide them through a series of exercise that might be something like watching a group of horses in the field interact with each other in their own social environment and labeling maybe which horse's personality fits people in their own family.
Quite often what we do in these things is we consider that the recovery work, let's say, doesn't take place in my therapy room. It takes place outside of it, where they actually practice the skills that they've learned, some of the things that they found out about themselves. So, however, how does that work in your area? Because you're not sending them home with a horse. So how do they reinforce what they've worked on with you, let's say with an actual horse, at home?
So the horse is a point of interest that keeps people's attention and also gives them feedback. But what it's creating is something that can be used anywhere. That calm, confidence, attentive to social cues that aren't always verbal, because really we give off a lot of body language as humans, but we've just been taught not to pay attention to our own or others' body language. So as you become more attuned and in that basically mindful state, it becomes easier to stay there, and you see so much more.
So by helping them pay attention on purpose to the horse and with your guidance, then you can translate that into paying attention to purpose in different things, like maybe in class, maybe with friends, maybe with a parent, maybe to themselves.
Absolutely. And so in session, you might be using the horse as a metaphor to gain insight for the person, teaching them how to understand a little bit more about themselves. And then with that information that they gained, they begin to practice it, not only, like I said, with a horse, but with everybody that they encounter and every situation that they encounter. It might be, everybody comes in with their own strengths and limitations. So somebody who's very fearful of horses, that doesn't necessarily contraindicate them for doing equine therapy. That might actually make a really cool opportunity for them to learn to connect despite their fears.
So, for people out there who may be listening to this podcast and may be interested and say, gee, that's something that I think I'd like to get involved with, how does one become trained in equine therapy, Sasha?
So here again, there are different certifying committees. So EGALA is the biggest one, and Jim, maybe you can even post links on your next to your podcast for
Love to.
people that are interested in this. I'll give you all the links, but EGALA is probably the biggest one right now. There's also Gestalt training. There's an OK Corral series, which includes riding, but similarly follows the EGALA model. Besides that, then there's a PATH is another certifying agency. So typically it involves a horse specialist, which is just an individual that manages the horse, the trained therapist that is probably certified through one of those agencies, the horse, and then the patient. Occasionally the horse specialist and the therapist are the same person, but in a lot of models, there are two people present for that.
That sounds very exciting and something that we're always looking for to open up possibilities. We always ask people to have a beginner's mind rather than an expert's mind. And it sounds like when they were referred to you as odd, they may have thought that you had an expert's mind. However, it sounds to me like when you walked into that barn, you opened up doorways to possibilities and you developed that beginner's mind. How exciting was that?
Oh, it was amazing. And I credit them for the work that I do with people now, because I was able to translate that calm, assertive energy and presence and attention to things that aren't openly said, to sitting with patients and seeing them speak in ways that are not through words. And it's been absolutely amazing, and I want to introduce more people to it. So if you have an interest in equine therapy, I would say absolutely try it. Equine therapy is a little bit better than just going and getting lessons on riding a horse, because you really get the correct introduction and more that whole mind, body, spirit interaction with a horse. So I would suggest that, but even just being around the animals can be incredibly healing.
So not only does this maybe help you with your emotions in dealing with horses, it's not only just for that, it's for to open your world up and to transfer these type of skills and this type of mindfulness and paying attention on purpose through various avenues in your life. And I know you well, and I know that you've carried that beginner's mind out of that barn when you were a little girl into your life and really explored that. So if someone would like to get in contact with you, maybe to get a little bit more information, or how would they do that, Sasha?
I'd be happy to give you my email, and you can post it.
We'll post that. And actually, what I think we'd like to do is we'd like to go on location that sometimes. So perhaps we could come out, you could get to fishing with that bait crew out there, and we could maybe film a session and you could guide us through it, and we could put that up as a video on our website, which might enhance and educate some people into what you do.
Yeah, I would love that. I think that'll be a great sequel to our conversation today. You know, really what the horse has allowed me to do and allow many others to do is you might end up with a diagnosis or, you know, like me, just that label of being odd. But a horse doesn't know that. A horse doesn't know that, and they don't really care about that. And so what Jim is always talking about is not looking at yourself as a label or a diagnosis, but seeing yourself as the whole person, the whole being, and looking at the opportunities that you have, maybe despite limitations, through your strengths. And that's what this is all about. It's taking it out of that cold office and putting you in a space that the sun shines and, you know, the smell of horses there.
Have you been able to create that scent, to bottle it?
No, but I found out that I'm not alone in that.
Odie Barn. Odie Barn. Well, and again, when we talk about enhancing, enriching all the senses, okay, and for people, it's a sensation and it's a scent. We attach our judgment to that.
Yes, definitely, and positive association is there for me, and I think that's the love of it.
Well, this is great. I really love your positivity. I love your energy. I love to see you come alive. I'm wishing that everybody could see the smile on your face when you begin to talk about these things and the passion and energy that you drive behind your forces.
Well, thank you, and I love what you're doing here and giving people knowledge about all the opportunities that are out there for them, because we don't often talk about opportunities. We talk about fears, and you're changing that.
So, Sasha, our story has definitely not ended. It only continues. And we're hoping that our path soon, is if the weather ever cooperates, perhaps our path could lead to your barn, and we'd love to participate in what you do.
I would love that. So we'll stay tuned.
Until then, we'd like everybody to stay tuned, to check out the links and prepare yourself for our video adventures in the future. And as always, we ask you to forgive yourself, to forgive another. We offer our free prescription, fruits, nuts, and vegetables. Unplug the television and take up fishing. And for a truly mindful experience, we suggest that you fish without bait. Till all are free, none are free. Namaste.
Please check out our website at fishingwithoutbait.com, where you can listen to the show, comment on our discussions, and find out where you can subscribe to our podcast. If you're interested in flying the colors of Fishing Without Bait, click the shop icon on our website. We have clothing, mugs, cell phone cases, and so much more. Show the world that you fish without bait. This show is a member of the Sorgatron Media Podcast Network. Find out more at sorgatronmedia.com.